Hello everyone, and welcome back to another episode of Ask the Doctor. Today, we are discussing cancer screenings, and with me is Dr. Crain Garrot, a Georgia cancer specialist at Northside Hospital. Welcome in, Doctor.
Hi, I'm Dr. Crain Garrot. I'm a medical oncologist with the Georgia Cancer Specialist, part of Northside Hospital Cancer Institute.
First, at which Northside locations do you practice?
I practice in our Canton office and in our Marietta office.
What are the benefits of cancer screenings?
Cancer screening is very important. Multiple different cancers have standards of care. For instance, lung cancer with CT scans, or breast cancer with mammography, or colorectal cancer with colonoscopy, and prostate cancer with PSA screening all improve overall survival, meaning patients who undergo screening are more likely to be cured if found at an early stage rather than have been found at a later stage.
Who provides cancer screenings?
Yeah, that's a great question. So as a cancer provider, I actually see patients after they have been diagnosed with cancer. However, we rely on our primary care doctors and our gynecologists and other providers to implement cancer screening. For instance, primary care doctors will oftentimes refer patients for mammogram or refer patients to a GI specialist who will perform a colonoscopy. Or a patient will see a gynecologist for a pap smear and cervical cancer screening. Similarly, primary care doctors can order or refer to a pulmonologist for lung cancer screening with a CT scan.
What happens when a patient is diagnosed with cancer?
After a cancer is diagnosed, most patients will undergo staging procedures and then see a cancer provider and a cancer team to implement a treatment strategy. And the hope is that we have found the cancer at an early stage, which would then lead us to be able to cure the cancer more readily.
What is the recommended age for colorectal screenings?
Multiple organizations such as the CDC, the American Gastroenterology Society, and the American Cancer Society all recommend that patients undergo colorectal cancer screening at an age of 45. And that is because the average age of colon cancer incidence, meaning when it comes to medical attention, is actually getting earlier in people's lives. And many younger patients are being diagnosed now, so the age of screening for colorectal cancer has moved down to age 45.
What is colorectal cancer screening?
So for colorectal cancer screening, we know that over 150,000 people are diagnosed in this country every year with colorectal cancer. And one of the best ways to screen for that is with a colonoscopy. And that's a very easy procedure. Many people would think that it's a difficult procedure, but it's actually an easy procedure that is performed by a GI specialist. Most patients are going to have a prep the night before, and they're going to clean out the colon, have a colon cleanse, so to speak, and they're going to have a colonoscopy the day following. And that purpose is to find an early stage colon cancer so that it can be cured when it is a stage 1 or a stage 2. Stage 1 and stage 2 colon cancers are highly cured more than 80 to 90% of the time with a simple surgery.
What happens if a polyp is found during a colorectal screening colonoscopy?
If a polyp is found during a colorectal screening colonoscopy, most of the time that is a benign polyp. They're called hyperplastic polyps, and most of those are just taken out and they never have any consequence. If someone doesn't have a colonoscopy and those polyps remain, then over the years those small polyps can become cancerous. So a benign polyp over many years, in fact 5 or 10 years, can become cancerous. Not all polyps become cancerous, but some do. That is the purpose of taking out all of the polyps along the way so that they never become cancerous, which is one of the reasons why we believe there's a benefit in colonoscopy.
If you have a family history of colon cancer, should you get screened early?
That a lot of patients have a family history, and if someone has a family history of colon cancer, they should be screened earlier than standard. For instance, if you have a family member who had a colon cancer at age 50, you should undergo screening 10 years prior to your family member at age 40.
What is lung cancer screening?
So lung cancer is also one of the cancers that we advocate for screening. We know that patients who are former smokers or patients who are current smokers, patients who have smoked at least a half a pack to a pack per day for about 20 years are at risk for lung cancer. The idea is that lung cancer can be found on a CT scan, and nowadays what we do is perform a low radiation dose, I should say, CT scan, which looks at the lung tissue. There's no contrast administered through the vein, so a patient would not need an IV, but the idea would be to do that CT scan, which would find hopefully smaller cancers, and if you find a smaller cancer is much more curable than if you don't screen and the cancer progresses and gets bigger and then becomes a non-curable cancer.
What is breast cancer screening?
So breast cancer has been one of the cancers for which screening has been performed for many, many decades. I think we've known probably since the 80s or at least the 90s that breast cancer it can be detected by mammography or mammograms, and the idea that we would find that cancer at an early stage. So I think this is one of the cancers that everybody is very familiar with, and certainly all the primary care physicians and gynecologists and even everybody in the community has embraced breast cancer screening as a standard of care, and we have rejoiced in that. We love that.
Can you share some breast cancer facts and statistics?
One of the things that's most important to know is about 1 in 8 women will be diagnosed with breast cancer. So it's important for everybody to be screened. We know that screening should start around age 40. That was actually updated this last week. The U.S. Preventative Services Task Force updated the recommendations for women to receive mammograms every year or every other year starting at age 40. Several other large entities such as the American Cancer Society also advocate between 40 and 50 and definitely over 50 that women receive mammogram screening.
Can you share some more information about prostate cancer screening?
So prostate cancer is an incredibly common cancer. Up to 280,000 men are diagnosed with prostate cancer every year in the United States. It isn't always a disease that is going to cause a man to go on to die from prostate cancer. Many people are aware that prostate cancer can live with a man and be existent for many, many years before causing a problem. However, screening for prostate cancer is very important because we know from several large clinical trials that it does improve overall survival by finding the disease early. So we do recommend that a man who is of average risk, who's about age 50, be screened once a year with a PSA. Some advocate for every other year, and every other year is okay. And then for high-risk populations, men who have family history, African American men, or men who have had other cancers, then they should be screened starting at age 40 or 45. And then very high-risk patients who have had more than 2 family members should be screened at 40 or earlier. And those are the usual age recommendations for prostate cancer. One of the things about prostate cancer is that the treatment modalities are very effective to cure it. As much as 75 to 80% of men with early stage prostate cancer are cured of their cancer when treated at an early stage.
What other cancer screenings are recommended?
So cervical cancer is also recommended for screening with a pap smear and an HPV test that is accomplished by the gynecologist, and also skin cancer screening. While we don't really know that skin cancer screening will improve overall survival, it is certainly beneficial to prevent the more indolent cancers like squamous cell or basal cell, but most significantly the more aggressive melanoma. To find melanomas at an early stage will enable the dermatologist to cure it at an early stage, usually with something either like a Mohs surgery, which is a surgery to remove it, or a full excision by a surgical oncologist. And that is how melanoma is cured. And then melanoma can become metastatic, unlike the other skin cancers, which we rarely see become metastatic. Melanoma can become metastatic, so it is important that any abnormal mole or spot on the skin, especially anything that itches or bleeds, or anything that changes color or size or is irregularly shaped. Those are all the markers of a skin lesion that should be checked out. And if you were to go to any of the different providers who provide cancer screening and they find early stage cancers, then you have a much, much higher chance of being cured of that cancer and never dealing with it when it becomes more advanced.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.